Hi everyone. Today we are going to talk about the comprehensive evaluation of the poisoned patient. We will start with the first point of evaluation, that is airway, breathing and circulation. And in airway, breathing and circulation, first we will check respiration rate. Now what is respiration rate? Respiration rate is the number of breaths per minute, or we can say the number of movements indicative of inspiration and expiration per unit time. And oxygen saturation is the fraction of oxygen saturated hemoglobin relative to the total hemoglobin in the blood. And after this we will check pulse, BP and dysrhythmias, that is the abnormal and irregular heartbeat. Second point is the level of consciousness. And in this, we will check if there is any presence of seizures, confusion, agitation, and psychosis. And the third point is chest. In the chest, we will look for the evidence of aspiration. Now, what is aspiration? Aspiration is when something you swallow goes down the wrong way and enter your airway or lungs. And bronchoconstriction. Bronchoconstriction is the constriction of the airway in the lungs due to tightening of surrounding smooth muscles. After chest, we will evaluate movements and muscles. First, in which we will look for tone. Next, fasciculations. Now, what is fasciculations? Fasciculations, we can say muscle twitch, is a spontaneous involuntary muscle contraction and relaxation involving fine muscle fibers. And after this is myoclonus. Myoclonus is a quick and involuntary muscle jog. And next we will check tremor. Now what is tremor? Tremor is an involuntary, repetitive, abnormal shaking movement of the body. And in the last, we will look for ataxia. Ataxia is inability to coordinate involuntary movements. Also evaluate two types of reflexes when evaluating the poison patient, that are tendon reflexes and plantar responses. Next step of evaluation, we will look for miosis in eyes, that is the excessive contraction of the pupil of the eye, and diopia, that is the double vision, and strabismus. Strabismus is a vision disorder in which the eyes do not properly align with each other when looking at an object, and a pinpoint pupil and injected conjunctiva. In the next step, one will look for abdomen examination, in which a person will look for hepatic or epigastric tenderness, ileus, and palpable bladder. And when examining skin, a person will look for temperature, chemical burns, self-cutting, needle prick, cyanosis, flushing, sweating, blisters, pressure areas, or pillow erection, that we usually call goosebumps. After that, a person will look into the mouth if the mouth is dry and if there is any excessive salivation. And in the psychiatric evaluation, one will look for features of psychiatric illness and mental capacity. This is the summary of the comprehensive evaluation of the poisoned patient.